Good morning. It's Dr. Ferguson coming to you from the Passioncam. Hopefully everybody's having a wonderful day. This morning I just thought I would talk just a little bit about water. Why water? So many times I get my patients asking me about water and saying that they don't like water, they don't want to drink water, and why can't they drink tea and soda and Kool-Aid and whatever beverage they want to drink. Well, none of those are water. Your body is made up of about 65% water if you're a man. If you're a female, your body's made up of about 55% water. And if you don't drink enough water, you're out of balance. It's as simple as that. Water is important for every aspect of your life. It's important for moving your bowels. It's important for your complexion. It's important for how you feel. It can help with headaches. It can help with nausea and vomiting, constipation. The list goes on and on and on how important water is. So when you say why water, well, your body is over half water. And if you're over half water and you don't drink any water, then that kind of should tell you the answer right there. You got to drink water. But the other issue is, yes, there is water in your food, there's water in all these other drinks that you're describing, but they have to be filtered. They have other things in them. They have other compounds in them. And your body then has to make sure that the kidneys are going to work fine so they can try to filter out the water. Your GI tract is working fine so it can filter out the nutrients from the water. And you're having to go through all these different filtering situations as opposed to just having the straight nutrients. And there's a lot of different compounds in many nutrients. Say coffee, for example. If you push that into a machine that can analyze it, you'll find over 100 different compounds that are in coffee. And it goes back and forth. Is coffee good for you? Is coffee bad for you? That's really not my topic today. It's a bean that's grown outside, so maybe it does have some good, maybe it does have some bad, but again, that's not my topic. My topic today is water. And when you talk about water, not mixed with something, not mixed with all these other things that the person tries to put into it to make it taste better. If you put a little lemon juice, maybe, or squeeze a little lemon, but try to drink it in this purest form possible. Your blood's 82% water. Your muscles, 75% water. Even your bones, 12 to 25% water. So you can see that water is a critical part of your life. I'm sure many of you have heard that life is in the blood. Well, if life is in the blood and blood is 82% water, then what do you think you need to be drinking? You need water. So I encourage you to make water your major drink of the day. Not alcohol, not soda, not Kool-Aid, not juice, but water. Because water is what you're made up of. When they talk about how Jesus stayed in the wilderness for 40 days, when it came out, it talked about him being hungry, not thirsty. So go back and check that scripture. It talked about being hungry, not thirsty. And why was he not thirsty? Because common sense, based on that scripture and based on knowing science about water, he was drinking water while he was in the wilderness. So, water, water, water. How much water should you drink? A simple way to come up with that would be to take your ideal body weight and divide it in half, and that's about how much water you need on a daily basis to sit on the couch and watch TV. If you go out and you're sweating and you're burning and you're putting out a lot of perspiration, then you obviously need more water than that amount. You'll need a much larger amount. So for all of you who have not been drinking enough water and don't know it's important, it is important. Your body is over 50% water. I encourage you to start drinking water. Don't get all these additives, but drink straight water. What kind of water is the best? We'll talk about that next time. Dr. Ferguson, Passioncam, be blessed. Have a wonderful day.